easy technique for removing a ring. As you know, sometimes patients have had rings on for many years and they haven't been removed in a long time. The current solutions include, a ring cutter, which is obviously an expense to the patient in terms of, damage to their ring. That can generate a lot of heat, and oftentimes, the digit needs to be anesthetized before something like that.
So this ring is stuck. We're going to show you how to get it off. Things you'll need: a mask, which you can find virtually anywhere, especially now with COVID. You want to get one that has the wider ties. Something flat, wide is best. You want to try to avoid the one with string type ties if you can. And then you may need a simple suture removal kit. Ideally, you want a pair of tweezers that do not have teeth, so some non-tooth pickups. That's really all you need to get a ring off. And so we'll show you a quick demonstration here of how we use a mask tie to remove a ring that is stuck. And just start about a ½ centimeter distal to the PIP joint, because this is really all you have to clear here. And so I'll just come here and I'm just pinching it and I'm wrapping fairly tight. You want to go about exactly one width of the tape each time you pass around, and just use your other finger to help present it to yourself as you go around. And it also keeps tension on it for you. So I'll keep pulling, and I'll use my thumb to push it. When I get to the bottom, I'll use my index finger to again roll it up to myself to keep it under tension, and I'll keep going around. And you can see we're getting pretty good compression here and trying to squeeze the edema out of the finger proximally. And we'll come around again. And now this can be the tricky part. As you get close to the ring, just pinch it there with your thumb to secure the tension. Take your non-tooth pickups and bite just the end of the mask tie to help slide it under the ring and present it to the other side. And then once you get it through, you can pull that through. And now you want to slide the ring as close to there as you can, and you're going to hold constant tension on this free end of the mask tie, and you're going to slowly pull, and you get this wobbling effect that will move the ring over the tight tissue, and it just very easily will gradually pull the ring off, just like that. So this patient has a 90-degree flexion contracture of the PIP joint of multiple digits from a past stroke, but you'll see this technique will work even here. So here we are wrapping the mask tie from distal to proximal, going around the finger and trying to squeeze the edema out of the finger proximal past the ring. And once you get to this point where you're at the ring, try to pass the surgical mask tie underneath the ring and retrieve it on the proximal end with the pickups, as you can see here. And then once you get it through, you want to try to hold constant tension on that string tie that you passed underneath the ring, and then gently unwind it going around the finger. Sometimes you have to keep a little pressure on the wound up part just to make sure it doesn't unravel. In some patients who have particularly swollen fingers, this can be a little uncomfortable, so you could augment this with a digital nerve block if you wished. Using this technique, I would avoid using any lubricating fluid as it may weaken the tie.
And it just shimmies it like piece by piece like that.